we recently did a case where we used magnets to help surgically to help the patient lose more weight. Tell us more about that and the advantages of that over traditional surgery.
Yes, so that's an exciting new field. Really, the way it works is when you want to join two pieces of intestine together, then traditionally, I mean, if you look at it historically, then we've been stitching them together. And then more recently, we've been stapling them together. So when we do bypasses or we do this procedure called SADI, which is, DS or SADI, these are procedures where we join parts of the intestine together. We've been using either stitching or magnets, or staples. But now there's been a revolutionary new approach where we can join two pieces of intestine without any stitching, without any cutting, and we can do an endoscopy. Firstly, I asked the patient to swallow a magnet, and then I did take an x-ray to see which part of the intestine the magnet is sitting in. And then I do an endoscopy and I place another magnet in the first part of the small intestine. And then I join these two magnets together, I just bring them close and they attach. And at this point, there's no new join, but the magnets are sitting next to each other. When the magnets sit next to each other, then over the next 3-4 weeks, they gradually create a new join, and then they pass out in the stool. So the patient doesn't have any magnets anymore in the body, but meanwhile, they've created a new path. And the risk of bleeding or leaking from that is virtually zero because it gradually creates a new anastomosis. So we did the first one in all of the Northeast actually recently. That includes all the states, Massachusetts, New York, all of the northeastern states. We did the first one, and I'm proud to say that the patient did fantastic. She didn't have to change anything in her diet to start with.
Okay.
We could discharge her. We could have discharged her the same day because it was all endoscopic and laparoscopic. But we did keep her overnight just to watch her, and then we did x-rays subsequently. She's passed the magnet and she's losing weight pretty effortlessly.
Fantastic.
So yeah, so it's a great revolutionary method of doing it, and I think that the risk is extremely low and the benefits are very, very high.
Very interesting. Very, very cool to be on the forefront of
Yes.
new happenings in weight loss surgery.
Yes, we certainly are in the forefront, and there's a lot more coming in this particular field. I think we'll find that there'll be more and more applications for it, especially patients who've had a sleeve and they've not lost enough weight. This is a very minimum procedure, which is all endoscopic and partly laparoscopic, but we're not cutting the intestine, we're not cutting the stomach, and we can give them a very strong additional way of losing weight, which is very effective. And we have to work towards, getting this approved by insurances. Some insurances don't approve it yet, but there are some that do approve it. So it's exciting. It's a great new field.
Very exciting.